Very good morning, my dear students. Myself, Dr. Yatish Kumar Joshi, PhD scholar in Health Profession Education, JNMC Vardha. Today, we will be continuing with the next module on principles of communication. So, in this module, we will see what is communication, what is the origin of communication, types of communication, communication styles, components of communication, communication process, principles of communication, other features of communication, barriers of communication, communication in healthcare services, and conclusion. To start with, what is communication? So, all of us, we frequently talk, we frequently interact with our parents, with our friends, with everybody in and around us, even we talk to ourselves. So this is communication. Basically, communication is the process of sending and receiving through verbal or non-verbal means. These messages may include speech or oral communications, written and graphical representations such as infographics, maps and charts, and signs, signals and behaviors. More simply, communication is said to be the creation and exchange of meaning. In simple words, sending a message from our brain to someone else's brain. Origin of communication. The origin of speech is traced back to 5 million BC, and the origin of communication technologies like writing, encryptions, etc. is dated back to 30,000 BC via cave paintings, pictogram, pteroglyphs, ideograms, etc. Writing, printing, telecommunication and internet are recent advances. As you can see in these images, these are pteroglyphs and cave paintings. They were initial modes of communication. Later on, writing was invented. In writing, initially sign language was there, which we even use today, like in the emojis which we used. With the advent of more technology, now there is a digital era of communication in which you can telecommunicate from a long distance via phone or internet. You can use a tablet or you can use a desktop or a laptop or a mobile phone. Communication has become very easy these days. It is like the whole world is in your hand via your mobiles. So what are the type of communications? There are mainly two types of communications. Verbal communication, which is oral and written, which uses some form of language. Then there is non-verbal communication, which is by the basis of your appearance, your body language and sounds. Verbal communication. Verbal communication are of two types, oral communication and written communication. The oral communication can be a face-to-face communication or conversation, a speech in which you deliver a lecture to a larger group, a radio in which your sound is broadcasted to a larger audience, or a podcast channel similar to a radio. Written communications can be a handwritten or a printed material which is typed via a mobile or a computer. The written communication can also be in forms of signs, pictures and symbols like the ones we use in emojis or like the ones which are used in traffic signals, etc. Non-verbal communications. They are appearance, body language and sound. You might have noted or experienced that our expression convey a lot of message to our friends or families. Your attitude is always judged based on your body language and your expressions. Even in the movies or series which you watch, the most important part of the series is the emotions of the actors in them or the appearance or the body language of the actors in them. We have commonly noted there are very frequent emotions that we express by just nodding our head, like nodding in a forward region means yes, or nodding in a sideward region means no. This is a simple communication by means of body language or by means of our appearance itself, or it is a sign language. People who are deaf and dumb, they are challenged, who cannot speak or hear. For them also there are ways of communicating using sign languages. And recently in the digital era, we use lots of emojis which are convey our message in a single image. In previous times, most of the traffic signals and the signals on the road or signages were used to communicate a message. A simple light means you have to stop, or you have to wait, or you have to proceed. So this is also a means of communication. And sounds, like the sounds which we make, hmm, uh-huh, all these sounds also convey a message to the recipients. So what are different communication styles? There are basically three styles of communication: aggressive, assertive, and passive. What is aggressive? Aggressive style is a close-minded style. It is a poor listener style. It is dominating. The speaker shows the attitude that he or she knows it all, and they point finger on the other party in the communication. They have a rigid posture or a body language and are very impatient. They usually interrupt the conversation and they are argumentative. Also, the listener or the speaker can be loud in the tone. This is not a very favorable type of communication. This can lead to increase in a lot of conflicts. The next style is an assertive style. Assertive style is a very good balance between aggressive and passive styles. Assertive style is a strong self-belief. The person or the speaker is having a strong or a good self-belief. They value for others. They are active listeners. They are empathetic. They are non-judgmental. They are self-aware and open and are having natural gestures. Moreover, they are self-motivated to be involved in the communication. You might be able to notice that assertive communication style is the best suited style in the communication in the profession of healthcare professionals or for doctors. And the last style is a passive style. A passive style of communication is when the parties are either hesitant or always agree to the fact. They lack interest in the communication, or even they lack self-belief. They are anxious and they fidget, or they use some gestures regarding anxiousness, like biting of nail, or rotating the finger, or playing with their hairs while they are in the communication. They usually don't make eye contact, or they have a slumped posture. They are not liked in the conversation by other parties and they lose self-esteem. This type of passive communication is not welcomed in a healthy communication style. So, after seeing the communication styles, which is aggressive, assertive, and passive, we will next move on to the components of communication. So, whenever we communicate, there are basically five components of a communication. First is the message which we develop in our own brain. Second is the delivery of the message, that it is having the component that we use to send the message to the receiver. Next is receiver of the message or receiving the message. It is a person who acknowledges or receives the message. Then there is a process of understanding the message. The receiver understands or processes the message, and after he understands or processes, he acknowledges or responds to the message. In an example, I want to deliver this lecture to you. So I first prepared my lecture. It is developing the message. The second step is I deliver this message. That is, I prepare this video which you can see and listen. That is the means of delivering this message. Receiving the message. When you look into the video, you look into the slides and listen to my voice in this recording, you will be able to receive the message. When you are reading and comprehending this slide, you will try to process the same information in your mind, and hence you will understand this lecture. So once you understand this lecture, you will respond or acknowledge by either going to next slide to the session, or by giving feedbacks, and or by giving the completing the assignments to this lecture. So that is the whole circle of communication. So if you can see here, there is a sender of the message, there is a receiver of the message, there is a message, there is a means of sending the message, and there is a feedback. So these are the basic components of the communication cycle. So what is the communication process? Communication process basically is the same like I explained in the previous slide. There is a start of the communication, which means the sender creates a meaning of the communication or the message that is to be sent to the receiver. He encodes or he adapts the meaning of that message into some means which can be transmitted to the receiver. Then he chooses a transmission channel. In our case, communication style is the meaning, online lecture is encoding, sending it via the Google Classroom is the transmission channel, you read the message is decoding. You read the lecture or you listen to the lecture is decoding. Once you decode, you understand the meaning. And once you understand the meaning, you encode it in your brain, or you by heart it, or you learn it, or you understand it. So after you understand it, you can use the feedback mechanism, or you can use the assignments to portray that you are understanding. And once you portray your understanding, you can further send that understanding to me. That is, I will receive your feedback, which is in decoding by you, and I will again decode the message and appreciate whether you have understood the message or not. So if you notice, there is noise. So in the whole communication process, there is lots of noise. Noise means disturbance or hindrance or barriers that can cause the errors of transmission in the communication process. Basic noise can be hindrance or any a physical barrier, which we'll be covering later in this seminars. What are the different type of barriers of communication? But in simple terms, noise is any disturbance either generated by the sender or due to the channel being used, or it is present during the receiver decoding or generating the meaning, or while sending the feedback. This noise can eliminate or reduce the meaning of the communication. So next we will be coming to the 7 principles of communication. This is important. While you frame a communication message, you need to keep in mind that the quality of the communication should be very good. To improve the quality of our communication, there have been 7 principles mentioned in the literature. We will be going through all these principles individually. So starting with the first point, clarity. Clarity in terms of thought and expression. It is important that what is the message that we want to give to the person. It should be clear. It should be clear in our mind as well as in the way we express it. It can be verbal or non-verbal means of expression. We should be very specific to address a single goal at a time. We should not try to include many aspects of communication into a single message or a single sentence. It makes it unclear or difficult to understand. We should avoid to achieve too much in a single attempt, because clarity enhances the meaning of the message and improves the understanding. It makes it to understand easy. Like you see, when we have a clear vision, we understand what is written. Similarly, when we have a clear message, the receiver understands it. If it is unclear or unformatted, then the receiver will not get the message. Like you see in the picture, formerly the Plain English Group has been now named as the Central Subcommittee Steering Group for the Facilitation of Brevity and Clarity of Language Usage in the User or Provider Communication Interface. Now this is such a complicated language. The former name, the Plain English Group, was much understandable and clear rather than the your message. I hope you understood what clarity in the message means. Next is correctness. It is very important that our message is grammatically and comprehensively correct. The use of words should be properly judged because a message should be exact, correct, and moreover well timed. A well framed message, if given at a wrong time, will not have its effect. Correct communication boosts the confidence of both the receiver and the sender. Correct message has a greater impact on reader and listener. There should be precision and accurateness in the figures or charts which we are being used. For example, if you use a chart, it should have exact values rather than range of values. Because charts is also a means of communication. You should use appropriate and correct language in the communication. If the receiver cannot comprehend the language you are using, then there is no use of the message, even though it is framed in a very good method. As you can see in this image, all these three persons are trying to lift the patient from the chair. And because the doctor was not able to communicate properly, the patient is where the patient is lying below the chair table. You can see the leg of the patient. And that is why we lift on 3. This means the timing of this doctor was wrong. If you can see this image, the upper minions, they are telling, let's eat boys. The verbal meaning of this sentence is that they are supposed to eat the boys. But the actual sentence should be, let's eat boys, which means they both are going to eat something. The proper use of a punctuation mark can drastically affect the meaning of your sentence. Concreteness. Concreteness messages, concrete messages tell the facts. They do not deviate from the fact and they are very particular. It makes the interpretation accurate and it uses figures to support the fact. Like you can see, if a deer thinks that the wolves mostly don't eat a deer, mostly is not accurate. It is having probability in it. So there can be a circumstance where actually wolves love to eat a deer. So they could ratherly frame it that wolves usually eat deers. It is mostly better to avoid them. Completeness. Completeness, a sentence should be complete and a partial use of words in negative tense can be dangerous at moments. Sender should consider the receiver and communicate all the facts and figures related to the message. As you can see in the image, the first minion wants to eat something. The second minion says it tastes good. But before his sentence is complete or before he continues the sentence, which is it tastes good after it's cooked, the person responds to the image. Next, courteousness. Message should show the sender's expression as well as respect the receiver. It should be sincere, tactful and thoughtful message, considering the viewpoint and the feelings of the receiver. It should be unbiased. Omit expressions that irritate, hurt or belittle. Grant and apologize good-heartedly. Especially in medical health profession, it is important that the doctors are courteous to the patients. They should respect the patients. You should consider the patient's view of point and feelings of the patient. You should never try to irritate, hurt or belittle the patients. Consideration. Consideration is when you speak, the sender needs to consider the importance of the receiver. The you attitude. The you is not the sender, the you is the receiver. The sentence should be framed in the benefit of the receiver. Try to put in yourself as the recipient's place while framing the message. You should have empathy and human touch in your messages. Focus on the receiver, that is the you. Show benefits of the listener's perspective. Emphasize positive and pleasant facts. Apply integrity and ethics in your consideration. It doesn't mean that if you have to talk positive and pleasant, you tell lies or fabricate improper facts to just please the receiver. The message should be concise. The famous movie Three Idiots, you might remember this scene when the teacher puts Amir Khan out. Then Amir Khan comes back in and he tells that he wants to take back the instruments that record, analyze, summarize, organize, debate and explains information which are illustrative, non-illustrative, hardbound, paperback, jacketed, non-jacketed with forward information, introduction, table of content, indexed that are intended for the enlightenment, understanding, enrichment, enhancement and education of the human being through sensory route of vision, sometimes touch. So this is not a concise word. That is why the teacher does not understand him and he tells कहना क्या चाहते हो. The answer is simply books. So the words, which minimum use of words, it should be done to convey the message. It saves time both for the sender and receiver. Saying it in the least possible words without compromising on the other C's like concreteness, completeness, consideration, etc. is very important. By eliminating unnecessary words, the main message stands out and it also avoids the repetition. Okay, so these were the 7 C's of communication. Next, there are two another features of communication, that is feedback and timing. Feedback. After the receiver processes the message, he or she provides feedback in verbal or non-verbal means. It is important to acknowledge the feedback and accept it wholeheartedly. Timing. Timing is very important, the most important part of communication, as a perfectly framed message when delivered in wrong time will be useless and deemed inconsiderate. So once you consider all the factors affecting communication, you use the proper style of communication. Still, in instances, there will be occasions when the message is not conveyed properly to the receiver. This may be due to the barriers of communication. Like when we were studying the process of communication, you noticed the noise. Noise is one type of barrier to communication. Next, we will check into the other barriers of communication. So basically there are 4 types of barriers of communication. First is the language barrier, then is the physical barrier, psychological barrier and the cultural barriers. What is a language barrier? The receiver should understand what you're telling. That means if the receiver does not speak English and you babble 100 words in English, the receiver is not going to understand. You should use the proper language that the receiver understands. You should use a common language. You should use the glossary or the comprehension which is perceptible by the receiver. Like in the image, the sender is using pink color but the receiver understands only blue color. So the communication is a whole mixture of a mess and there will be no proper establishment of transfer of knowledge from the pink one to the blue one. The vocabulary should be simple and you should use examples because examples are a very good means of creating facts or making the understanding very easy. Second is the physical barrier. Physical barrier is a very important barrier. Improper place may create lots of background noise in which the communication cannot be established. If the place is not having a good ambience and the climate conditions is not favorable, a healthy communication cannot be established. So selection of a good ambient place is very important to establish a communication. You will have noted that all the hospitals or the consultations of the doctors are very calm places because in such calm places and good ambience the patient feels less anxious and it's more open to the doctors. So eliminating this physical barrier is in the hand of the sender or in the hand of the doctor. Psychological barriers. So the mood of the receiver is very important. If the receiver does not want to listen to you, he does not want to pay attention, or he is daydreaming like in the lecture classes, this psychological barrier is going to eliminate the essence of communication. It is important that the sender and the receiver both be interested in the communication. Eliminating psychological barrier is not in the hands of the sender alone. It is also in the hands of the receiver. Lastly, cultural barriers. Every individual that we interact may not be of the same country, may not be of the same socio-economical status, may not be in the same rural or urban areas. Even they may have a different value system. Respecting these is very, very important in our profession, because cultural respect, when it is given to the patient is more open and more expressive about his illness. So all the language barrier, physical barrier, psychological barrier and cultural barriers needs to be considered while establishing a good communication with our patients. This will help to improve the rapport with the patient, and there will be a more participation of the patient in the diagnosis and treatment planning procedure, and make the relationship into mutuality rather than a passive relationship. Now, communication in healthcare services. All these features that we have discussed till now, the process, the components, the communication principles, the styles of communication, and the factors that needs to be considered are all relevant to communication in healthcare services. Because in the field of healthcare profession, the doctor and the patient both are actively involved and partners in providing diagnosis and treatment plan. The important factors that I want to address in this lecture are that the communication of the doctor with the patient should be in a patient manner, that is having patience while communicating, in a respectful manner, in a non-threatening manner, non-judgmental manner, and empathetic manner. We will be seeing the importance of all these individually. What is patience? Patience is basically giving time. Never be in a hurry while communicating with patients. Take time to listen to them as well as when you speak to them. Active listening is a very important part of doctor-patient communication. We have discussed this point in doctor-patient relationship as well as in the qualities of the doctor. We need to give sufficient time to every patient to express their concerns. This not only helps to develop a good rapport with the patient, but also aids to reach the depth of the problem for diagnosis. Next is respect. Being a doctor makes you privileged to know or inquire about the intimate details of patient's personal life. Disclosing such details may not be comforting to many patients. So it's important to uphold patient's dignity during and after conversation of such challenging situations. Never ever use offensive or belittling words to patients or attendants. Also respects patient's privacy, decisions, and timing schedules by maintaining confidentiality and avoiding inconvenience in such context. Non-threatening. Most of the patients are anxious and apprehensive about the lack of the knowledge regarding their illness and probable outcomes of the treatment. It is important that the doctor uses a positive approach in his words while explaining the illness and management as well as prognosis to the patient. Threatening language may reduce the trust of the patient on the doctor and in turn lead to breach in the relationship. In case of difficult outcome, reassurance and empathy in your language can prove to be very helpful for the patient to cope up with the situation. Non-judgmental. Detachment with the situation of the patient and his illness is very important. Doctor should never jump to decision in hurry or judge the patient halfway through the communication based on his physical, social, financial and psychological condition. A non-judgmental approach not only helps the patient to be clear in his conversation but also improve the trust in the doctor to reveal the complete history and background of the illness. And lastly, empathy. We will frequently be hearing this word because empathy is the biggest tool that the doctor can use while treating a patient. Care and cure both are necessary to treat patient's illness. But when cure is not possible, then caring for the patient remains the most important duty of the doctor. Listening to the patient's conversation patiently, being actively involved in the communication, and trying to understand the worries of the patient will help them a lot to relieve their anxiety. Being empathetic about the patients and choosing words wisely to address the patient is in more empathetic way helps the patient to cooperate with the treatment procedures and results are more positive outcome. Few other important points to remember while communicating with the patients. We should have a calm and soothing ambience while interacting with the patients. It helps them relax. Use proper body language, showing interest in patient's conversation while maintaining eye contact. Do not interrupt when the patient are explaining about their illness. Never do multitasking while communicating with the patients. Never talk down the patients. In today's digital era, when we are having mobiles in our hand, it is most commonly noted that while in consultation, the doctor is using his mobile texting someone else or talking to the attendant or talking to the lab technician or the lab fellow while the patient is telling his history or giving his speaking regarding his concern. Such attitude of the doctor decreases the interest of the patient in their interaction. Such uh, things should be avoided in our communication interaction with the patients. So we have covered mostly all the points regarding the communication, its origin, its components, its processes, its principle. Then we have looked into the styles of communication, and lastly we saw the communication and few points of communication in relevance to the doctor-patient communication. So I would like to communicate my today's session that most of our problems in our life are due to lack of proper communication. It is important that we communicate and make the message clear, concise, concrete, correct, and complete and courteous. And also it is important that we note that the message is being perceived or received by the receiver. Because even though we may be good in communication, but if the receiver is passive, then the message will not be perceived in the way and will not bring about effect. Okay, so this concludes my lecture. In today's session, we will only be having lecture. In next week, we will be having an assignment. Okay, thank you very much for your patient listening. If you have any queries or any doubts, you can message me on WhatsApp or you can send a private message in the Google Classroom, or else you can mail me. Okay, thank you all. Have a good day. For any queries, you can contact me.